Doctor, is there a possibility of having an abortion after IVF treatment? You are selecting the sperms and the eggs. Why should an abortion happen?
In a natural pregnancy, if 100 couple conceive, 15 to 20% of them lose the pregnancy. Abortion happens for various reasons. The most common cause of abortion in a woman is an abnormal genetic material of the fetus, and it is also known as aneuploidy pregnancy. Nature's quality control prevents an abnormal pregnancy or an abnormal baby coming into this world. In reality, nature plays a similar role in IVF also. An embryo in an IVF lab can look normal, but it has to implant and further progress for 14 days for a positive pregnancy test. It should progress for 2 more weeks before we see in the ultrasound, and then progress for 8 to 10 weeks before we make out the abnormalities. To a large extent, a pregnancy loss happens with a blood test positive. The scan does not show anything, then it's called a biochemical pregnancy loss. When ultrasound shows a pregnancy that is inappropriate to the duration and with no fetus formation, we say it's a blighted ovum. The third category is the formation of the fetal heartbeat, and subsequently it stops, and it is called fetal demise. An IVF pregnancy, earlier people used to think it reduces the abortion rate. Still, the answer is whatever happens in a natural pregnancy, all rules apply to an IVF pregnancy, be it abortions, be it abnormalities, be it hypertension in the woman, and be it growth retardation or bigger babies. In other words, whatever applies to a normal pregnancy, all those things apply to an IVF pregnancy. The current technologies to reduce pregnancy loss include time-lapse embryo monitoring and or pre-implantation genetic diagnosis, otherwise known as embryo biopsy, to rule out any chromosomal abnormalities, and that selected embryo is transferred. Even this reduces the chance of miscarriage but does not eliminate a pregnancy loss.